This is actually an abnormality right here.
Besides skin cancer, breast cancer is the most commonly diagnosed cancer among American women, and 3/4 of the women who are diagnosed with the disease are 50 years of age or older. It stands to reason that there's a consistent effort across the country to encourage regular examinations, mammograms, and self-breast examinations as a way of ensuring early detection of the disease. Dr. Kassan Blake is a breast cancer surgeon at the Karmanos Cancer Institute. She says the mammogram is the best early screening test for breast cancer.
Traditionally, women would do an exam or feel a lump in their breast. Fortunately, most women now are being diagnosed before it even gets to that point by having annual mammograms, which should start at the age of 40. Mammograms can pick up very early breast cancer, frequently stage 0 breast cancer, which does not have the ability to spread and does not require chemotherapy.
Jacqueline Jenkins is a former school teacher. Her doctor discovered a lump in her breast during a routine mammogram, and the resulting biopsy showed that the cancer was invasive, meaning it was in her tissue.
Actually, there were no signs. I had absolutely no clue. It was just going to have the mammogram on a regular basis. There's a possibility that if I would have been doing my monthly self-examinations, I would have found that lump sooner. I don't know if it would have made any difference, but I would like to have been conscientiously involved in self-examinations of my breast.
Self-breast exams are really important because mammograms can miss about 10% of breast cancers. And so in that case, we really rely on you coming in and saying, Doc, I feel something. My mammogram was normal, but I still feel something.
Ms. Jenkins and her daughter share a special bond because she's not the only member of her family to have breast cancer. Her sister was diagnosed 2 years before she was diagnosed, and soon thereafter, her aunt and her mother were diagnosed. In some families, there is a propensity for the disease. In fact, some women seek genetic testing to see if they're prone to getting breast cancer.
Well, there certainly is a genetic component for some women where they actually can carry the breast cancer gene. However, most women do not carry that gene that we are aware of. Breast cancer does affect Caucasian women more likely than African American women, but that's not to say that we are not affected. Breast cancer is more common to occur, however, in younger African American women than it is for Caucasian women. So it's just as important in your 20s to do a self-breast exam.
Ms. Jenkins has been cancer-free for 6 years now and says having undergone 4 surgeries, including a bilateral mastectomy and several weeks of chemotherapy, has made her personally aware that getting your annual mammogram for early detection of breast cancer can save your life.
The sooner you know, the better. That's why we should do it every year. Additionally, we should do self-examinations. Not only should we do these things to save our breasts, but to save our lives as well.
Be an active participant in your health. If your physician has not referred you for a mammogram at the age of 40, ask for one. Do your monthly self-breast exams. And just like you're concerned about having a healthy diet, be concerned about your breast health.